What's up, friends? Welcome back to Kimmy D TV, a place where nurses and aspiring nurses come to achieve academic and career success. I want to start by saying I'm sorry. I'm a little late. I said 2 p.m. and it's 2:15. I had a little bit of technical difficulties, so I'm going to wait until some people get in the building, okay? How was your week? If you're watching this in the post, you could always fast forward and go to, when we're going to be discussing the questions. How was your week? I hope you guys are having a great Mother's Day, especially for the mothers out there. You guys are amazing. I love my mother so, so, so much, and she knows that. And, I wouldn't be here without my mother in so many ways than one, not just biologically speaking, but, I really appreciate my mother. And for those of you guys who are mothers out there, you guys are the freaking best, because I know that job is totally not easy. Carrying a child for 9 months, pushing that child out, and taking care of that child is a lot. And for that, I thank you. I applaud you, all mothers out there. All right, guys. So as you guys come in, please hit the like button. Hit the like button on this Mother's Day. Claiborne Mathis says, I had a good week, but I did get braces, so a little sore. I'm sorry. I know. I remember when I first had braces. For those of you guys who don't know, I actually filmed my braces journey on my channel, so there's a playlist if you guys want to see it, and I don't regret it. It costs a pretty penny and it's worth it. Everywhere I go, people compliment me on my smile. But I like it, which is the number one most important thing. But I know you're sore now, but don't worry, it will be worth it at the end. I always recommend taking ibuprofen or Tylenol to help with the soreness, But congratulations on your braces. Oh, I like that emoji. Ooh. So yeah, guys, I'm gonna wait till a few people come in. So what did I do this week? This week I worked. I mostly worked. I also hanged out with my friends. What else did I do? I went to karaoke. I went to karaoke last night, which was fun. I feel like I can sing. I know I can sing. But yeah. So yeah, guys, I don't want to take too long with the introduction, but I hope you guys are having a great week. And we're going to start with our renal and diabetes lecture. I know that when I get to the middle, people come in and say, wait. But I gotta start. It's 3 minutes and 42 seconds, 45 seconds in now. All right, let's start, guys. Why not? Let me just get my PowerPoint ready. Don't forget, as you guys come in, to hit the like button. Okay. MED-SERG day 2. Okay. So this is the second Kimmy D TV live. So we're gonna jump on into the questions, okay? We're gonna jump on into the questions. Oh, Claiborne Mathis says karaoke streaming coming soon. Oh yeah. Yeah, I love karaoke. It's fun. I think my favorite artist to sing to is Whitney Houston. Just saying. I love her. All right, guys. So are you ready? If you're ready for this, I want you guys to type in the comment box ready. If you're ready. Or should I wait a little bit more? And as you come in, hit the like button. As you come in. Okay, Claiborne Mathis says ready. Okay, so we're going to start. Claiborne Mathis is ready. Hey, girl. Or hey, boy. I'm not sure if you're a male or female, but thank you for typing in ready. Okay, Claiborne Mathis is ready. So we're going to start. Okay. So we're going to jump right into the questions. So today we're going to be covering renal questions, and we're going to be covering diabetes questions, which is two major topics that tend to be on NCLEX. And of course, it's in your nursing school because those topics are major. Okay. So let me just share my screen and we'll get started. Okay. Okay. Starting now. All right, so we're going to start off with question number 1. Okay. All right. Question number 1 says, you are working on the MED-SERG unit. A patient who had acute renal failure is starting to enter the recovery period. Which signs and symptoms indicate to the nurse that the client is in the recovery period? SATA. So it's a SATA question, your favorite question. I know it's your favorite questions. It is select all that apply. So which is the correct answer? So SATA, select all that apply, means that, especially the new definition of select all that apply, especially when it comes to the NCLEX, that is that the question, the answer could be one answer, or it could be several. Okay, so I know some of your NCLEX study guides, study books can, especially if they're old, they could say that it's always more than one, but that's not true. SATA, especially when it comes to taking the NCLEX, it could be one answer or multiple. Okay, I found that in my school it was always leaning more towards multiple, but it could be only one answer that's correct or multiple answers that are correct. Okay, and in order to answer this question, you have to know what acute renal failure is. Some key words for those of you guys who are not in nursing school and maybe you're just here because you want to get a feel of it. Renal means kidney. Acute means like now, okay, versus chronic would have meant over time, okay? And recovery period is when the kidney starts to regain its function again after failure, okay? So acute renal failure actually has phases that the client goes to that builds up into the recovery period, okay? So the question is asking which signs and symptoms indicate to the nurse that the client is in the recovery period. So the question is trying to identify if you are able to know the signs, like what will you see in the patient to let you know that their acute renal failure is actually healing, okay? So that is what the question is asking. Let's see if anybody has the answer. Does anybody have the answer? What do you guys think the answer is? Anybody have the answer? What do you guys think the answer is? You guys want me to give it to you? Or you could guess. You guys could guess. An educated guess, though. Okay. Claiborne Mathis says, I know A is one of the answers. Okay. Increase in hemoglobin and hematocrit. Okay. Good answer. Good answer. All right. So let's see what the correct answer is. Okay. Let's see what the correct answer is. The correct answer is A, B, and C, okay? So the correct answer is A, B, and C. Oh, maybe E, but that is also a sign of renal failure. Okay. So yeah, so the correct answer was A, B, and C. And the reason is because... Okay. The reason is because, okay, there is going to be, so the correct answer is increase in hemoglobin and hematocrit, denial of nausea and vomiting, increased alertness, and no seizure activity. So it's not decreased urine specific gravity, and it's not increased serum creatinine level. So why is it? So the next slide, I broke down exactly why the answers are correct in a way where I would kind of research and understand for myself, so next time I understand. Okay, so the first thing I wanted you guys to see is, why is the answer not D, which is decreased urine specific gravity? Okay, so first thing is first, like, what the hell is urine specific gravity? So the normal specific gravity is, like, ideally you would want to memorize it, but I don't want you to like so focus on like, oh, I gotta memorize this. But the normal specific gravity is 1.005 to 1.030, okay? So it's a good idea to know it, okay? But don't go too crazy with it. Just look at it and know that that is the normal value, 1.005 to 1.03, okay? So what is a decreased urine specific gravity? A decreased urine specific gravity, which was answer letter D. Decreased urine specific gravity indicates that the urine is too diluted, okay, not enough solute. So what do we mean by urine is diluted? So if you ever use the restroom and you see your urine is like very, very clear and very, very white, the urine may be too diluted, okay? So that means there's not enough solutes, okay? So long story short, if it's clear like this, if your urine is clear like this, it is too diluted, okay? So this can be caused by drinking too much fluids, okay? Diabetes insipidus, that is a symptom of diabetes insipidus. We're not going to go too deep into diabetes insipidus, but diabetes insipidus has to do with the pituitary. So that's what causes that clear urine, and kidney failure. So if decreased urine specific gravity means that the urine is too diluted, means that the patient may be undergoing kidney failure, no way it's going to be in the recovery phase, okay? So a decreased urine specific gravity would not mean that the patient is going under the recovery phase of acute kidney failure, because a decreased urine specific gravity basically means that the urine is too diluted and that the patient is actually going through kidney failure, okay? So that's with that. Yes, Claiborne Mathis, you're right. Increased urine specific gravity indicates dehydration. Yeah, so it's like the opposite. So increase urine-specific gravity, dehydration. Decrease your urine-specific gravity means that the patient, the urine is too diluted. There's too much water, and too much of anything is bad, right? Because if there's too much water, your sodium levels could go down. A lot of things can happen, okay? So, and it could mean that the patient is going to chronic renal failure, okay? So it would not be answer number D, which is decrease urine-specific gravity. So I also put, okay, why not increase serum creatinine, okay? So serum creatinine, easy. Increased serum creatinine means that it indicates chronic renal failure, okay? Remember we talked about that in the last MED-SERG review last Sunday. We talked about serum creatinine and how we use that to indicate how the kidneys are working. We use BUN too, but it's really the creatinine level that we look at. So an increased serum creatinine means there's a chronic renal failure going on. So that means it's an ongoing basis. Like the patient has an ongoing issues with the kidneys. The kidneys are not doing their job, so the creatinine levels will increase because the kidneys aren't able to flush all that out, okay? So you guys have to understand the function of the kidneys. The kidneys, one of the functions is to remove waste from the body, okay? So if it cannot remove that excess creatinine, the serum creatinine will increase. So that means chronic renal failure, okay? So, and I also put, why is it A, increase in hemoglobin and hematocrit? So it's increase in hemoglobin and hematocrit because this is where your anatomy and physiology comes in, okay? This is where your anatomy and physiology comes in, okay? The kidneys produce erythropoietin, okay? And erythropoietin is a hormone that helps produce red blood cells in the bone marrow, okay? So I put this picture here so you guys could understand and see how it is. You see the kidney and the liver, you see they producing erythropoietin, okay? So this hormone, erythropoietin, sorry guys, erythropoietin stimulates the red blood cells in the bone marrow. It stimulates red blood cells to make it, okay? So basically, erythropoietin induces the creation of red blood cells, and red blood cells create more hemoglobin and hematocrit, okay? So what is hemoglobin and hematocrit? Hemoglobin is actually the protein on red blood cells, and hematocrit is actually the measure of hemoglobin within the whole vial of blood. So like, let's say this is a tube of blood. Blood is made up of a lot of stuff: white blood cells, red blood cells, all kinds of things. If you guys remember anatomy and physiology, and the hematocrit is basically measuring the amount of hemoglobin in there. So it's basically, I don't want to say the same thing, but it's almost the same thing. So yeah. So that is why an increase in hemoglobin and hematocrit means that the kidneys is in the recovery mode, okay? Because one of the kidneys' main job is to produce red blood cells, okay? Is to produce the hormone erythropoietin, which produces red blood cells, which produces more hemoglobin and hematocrit, okay? So if the kidneys are functioning well, the patient's red blood cells is going to come up, okay? So that's why they always say that, that's why a lot of times people wonder when they say, oh, well, how come the prerequisite to the nursing program is that they want you to pass anatomy and physiology within 5 years or 4 years, because this is the reason why. In order to know the abnormal of something, you have to know the normal. So they want you to know that the kidneys do produce erythropoietin, which produces red blood cells, and which it's produced in the bone marrow. which inadvertently creates more hemoglobin and hematocrit. I think one of the issues with students that are struggling with med-surg is sometimes it could be the lack of knowledge of anatomy and physiology. So that's why I stress, if you guys aren't in nursing school yet, when you're taking your prerequisite, especially anatomy and physiology, please pay attention, because it could cut down the amount of studying that you have to do when you get to your nursing program, and it can make your med-surg class that much easy, okay? So that is why, okay? So that's why increase in hemoglobin hematocrit. So why is it denial of nausea and vomiting and increased alertness and no seizure activity? Well, it's simple. The simple thing is that when a patient has acute renal failure, okay, and when a patient has acute renal failure, a lot of things can happen, okay? Causes and symptoms of kidney disease. So what could cause kidney disease? An infection, damage, a tumor, or side effect of a certain medication can cause kidney disease. There are some medications that are hard on the kidneys. Okay, so the symptoms you will see is fatigue, nausea, loss of appetite, itching, high blood pressure, difficulty in sleeping, shortness of breath. So to bring the point all on home, why would the patient have a denial of nausea and vomiting? Okay, well, think about it. If a patient's kidney is not working right and all those toxins are building up in the blood, because what is the function of the kidney? The function of the kidney is to remove those toxins in the blood. What is the function of that? If there is a lot of toxins going on, yes, the patient is going to want to vomit, okay? Because that is a natural response of the body. Like, you ever eat something bad and your natural response is to throw up? That's because that's your body's way of trying to remove all those toxins, all those, like, whatever you ate in your body that's not making right. That your body has its own homeostatic mechanism, and basically it has its own way of trying to heal itself. And that's one of the way the body tries to heal itself, is by throwing up and like releasing it, okay? So if the kidneys are now working back together, are removing the toxins on its own, yeah, the patient will have a denial. Denial meaning they're saying, no, I don't have nausea and vomiting. They're not going to have a denial of nausea and vomiting, okay? C, increased alertness and no seizure activity. This goes back. The kidney affects all areas of the body, okay? So yes, the patient will have increased alertness and no seizure activity because, like I said, all that toxin that is built up in the blood can affect the patient's consciousness, because, like I said, there's a lot of toxins in there, okay? So to break down a select all that apply question and to make it easier, I remember listening to Mark Klemek. If you don't know Mark Klemek, check him out on YouTube. He's a great NCLEX instructor. And he always said that you have to know the principles, because there's no such thing as memorizing bullet point A, B, C, and D for symptoms of recovery period and acute renal failure. You got to think through it, okay? That's how you answer a select all that apply question. You got to think through it. So you have to know you have to know what renal failure is, okay? And you have to know what, so if my patient is healing from renal failure, what will they have? Yes, will they have increased alertness and no seizure activity? Think about it. Yes, they will, because they don't have any toxins in their body bothering them. You have to know what does toxins in your body do. What can it do? Can it cause nausea and vomiting? Yes. Can it cause decreased alertness and no seizure activity? Yes. Okay. Can it cause decrease in hemoglobin hematocrit? Yes. Okay. So that is how we think through a select all that apply question. We got to think of it like as if it's principles. Okay. So does anybody have a question on the select all that apply question? I know I hit you guys with the select all that apply, but I wanted to do that. If you have any question, speak now or forever hold your peace. All right. So let's go to the next question then. Okay. The next question says, a patient's random blood glucose is 360. Okay. So random blood glucose, meaning that, like, let's say I'm sitting right here. It's two, what time is it? It's 2:42 right now. I just check my blood sugar at random. Okay. At any time. A patient's random blood glucose is 360. The patient is also experiencing Kussmaul's respirations, abdominal discomfort, and lethargy. Okay. Which additional tests should be completed? Okay, so right away when I see this question, the answer already popped out at me because it's one of those things where we talked about last week, like the matching. But I want you guys to think through it. What would you guys see? Okay, imagine first of all, you have to know what is the normal blood glucose level, like a random blood glucose level. Okay, and the patient is experiencing Kussmaul's respiration. Which illness do you usually see that is categorized or attached to Kussmaul's respirations? Okay, and abdominal discomfort and lethargy. Okay, so which additional tests should be completed? Okay, so this question is low-key asking you. It's kind of asking you what's going on with the patient. Okay, and through your answer of which test, they know if you know what's going on with the patient. So they're giving you a scenario. This is an example of how NCLEX and nursing school, they don't always just give you what's going on with the patient, like, oh, this patient has kidney failure. Sometimes they give you a list of symptoms and you have to figure it out, like what is the disease, and then think about, okay, so if you got the disease in your head, what tests do they usually order to confirm that the patient has that disease? Let's see what some people say. Let's see if some of you have this. Okay, Claiborne Mathis says B. Does anybody say anything else? Hit the like button. I know today's Mother's Day weekend. Oh, okay. Claiborne Mathis says, oops, my bad, D. Okay. Okay, hit the like button, hit the like button. What's the correct answer? All right, let's see the correct answer. Yes, the correct answer is serum ketones, okay? So I just put the definition of Kussmaul's respirations. So Kussmaul's respirations are deep, rapid, labored breathing. Oh my God, that's actually affecting me. So that's what the definition of Kussmaul's respirations are: deep, rapid, labored breathing, okay? So what disease is this? This disease is diabetic ketoacidosis, okay? So what is diabetic ketoacidosis? First of all, I said that this is seen in type 1 diabetes, okay? This is seen in type 1 diabetes, okay? And I put that there for a reason, okay? So what is diabetic ketoacidosis? What is type 1 diabetes, okay? So the first thing is first, type 1 diabetes is basically when the pancreas, which produces insulin, those beta cells in the pancreas are completely destroyed and the patient creates no insulin at all, okay? So I remember when I was in LPN school, my instructor gave me such a great way of distinguishing the difference between type 1 and type 2 diabetes. Type 1 diabetes is like, let's say you're painting a house, right? Type 1 diabetes is like, there's no paint in the bucket at all, so the house can't be painted. Type 2 diabetes is like, You take the paintbrush, you could paint the house, but there's not enough paint to paint this whole room. That's type 2 diabetes. But type 1 diabetes, there's no paint at all. So I hope that analogy helps you always remember the difference between type 1 and type 2 diabetes, okay? Now, type 1 and type 2 diabetes can both have dangerously high blood sugar levels, okay? So when patients with type 1 diabetes have dangerously high blood sugar levels, that is called diabetic ketoacidosis. When a patient who has type 2 diabetes has dangerously high levels, that's called HHS, okay? So with diabetic ketoacidosis, it makes sense that the patient's random blood glucose levels is 360 because the normal, let's Google the normal blood sugar levels. I think I put it there, but it looks like I didn't. Okay, so normal blood sugar levels, normal random blood sugar levels. That's how I study. I use Google, okay? So the normal blood glucose should be below 200 milligrams, okay? According to diabetes.co.uk. So it's supposed to be below 200 milligrams. And this question says that the blood glucose level is 360, so it's already up. And the patient is experiencing Kussmaul's respirations. And we already know that Kussmaul's respirations, or if you didn't know, now you know, is deep, rapid, labored breathing. So anytime someone has deep, rapid, labored breathing, that means they're having difficulty breathing. They're having abdominal discomfort, their stomach hurts, and lethargy. Lethargy means like they're very, very tired. Okay? Which additional blood tests should be completed? Anytime you see like Kussmaul's respirations, not all the time, but especially if you see it combined with a high blood glucose levels, 9 times out of 10, they're talking about diabetic ketoacidosis. We're talking about a diabetic patient who has a patient who has diabetes, who has a high blood sugar levels. So yes, the additional test that would be completed is serum ketones. We wouldn't complete a complete blood count because, okay, yes, they're lethargic. They could have low hemoglobin, but the key word we see here is a blood glucose 360 and Kussmaul's respirations. But blood glucose is 360, right? We're not going to choose BUN and creatinine because, as we know, we went over this last week, and the question before that, creatinine has to really do with the kidneys and how well it's working chronically over time, and BUN and creatinine has nothing to do with blood glucose of 360 at the moment, and liver enzyme has nothing to do with that as well. But serum ketones, it does, because with type 1 diabetes, guys, you have to know, with type 1 diabetes, and if the patient has diabetic ketoacidosis, the blood sugar is so high that the body begins to release ketones, which is very, very acidic, okay? Because the blood is already I don't want to say sugary, but sugary. The blood is already sugary, has a lot of glucose in there, and the body begins to create a lot of ketones, and ketones are very acidic to the body. Okay, so you guys know the body cannot be too acidic or too alkaleic. Okay, there's a normal pH levels that in the body. So if the body is too acidic, if there's too much acid in your body, what's gonna happen? Okay, first of all, there's going to be frequent urination. Okay, so why is there frequent urination? Because the body is trying to remove all that urine from the body, all that sugar from the body in the form of urine. Okay, and on top of that, some other things are going out, like potassium, some other important electrolytes, which will cause the patient to be dehydrated. So because the patient is dehydrated, it will cause the patient to have increased thirst because they're thirsty. If you're dehydrated, they say the last sign of dehydration is thirstiness. So the patient will have increased thirst because they're dehydrated. They're urinating all that urine out, so they're losing. Not only are they losing, because you have to understand, the body is trying to get rid of that sugar, so they're urinating it, they're peeing it out, but as they're peeing that sugar out, they're also peeing the good stuff out. So now they're thirsty because their body's like, hey, I don't have any electrolytes, so that's increased thirst. Okay, so they also have increased hunger. Okay, because it says right here, with high glucose levels, extra glucose spills into your child's urine. So they're hungry because all that sugar is going out in the urine. So now they're hungry because, the body needs sugar to function. Your brain needs sugar to function. And weight loss, okay? The patient, it says right here, your child may lose weight over multiple weeks while developing diabetes, leading to a potential diagnosis. So yes, in diabetic ketoacidosis, they will have weight loss. So a lot of people always categorize diabetes with overweight, but that's more likely type 2 diabetes. Patients who have type 2 diabetes, they're usually the ones who are overweight because they don't have enough insulin for their whole body to use, right? So that's why they always say it's good to put them on a diet so that a healthy diet so that they can lose weight, and that because they lose weight, they will have enough insulin for their body, right? And flu-like symptoms, okay? They will have nausea, vomiting, okay? So if this is a select all that apply question, why do you think the patient with diabetic ketoacidosis would have nausea and vomiting? Oh, I see somebody have a question. Claiborne Mathis says, once I looked back and seen diabetes plus Cousineau's, I knew I made a mistake. Yeah, that's okay. Yeah, but exactly. You see, Claiborne Mathis said she noticed diabetes and Cousineau's. It's like one of those matching things. We said that last week. There's some stuff where you just match and match, right? So yeah. So you're gonna see flu-like symptoms. You're gonna see nausea, vomiting, dry mouth, abdominal pain. Why? So when you have a select all that apply question with diabetic ketoacidosis, don't be scared, because you already know if there's ketones in the body, which is very acidic, the blood is already acidic, of course they're going to have nausea and vomiting because your body doesn't want all those ketones in there. Your body doesn't want all that acid in your body. So it's gonna throw it up to get rid of it. Yes, you could have dry mouth as a result of that because they're always thirsty. So yes, you would choose that to select all that apply. You're going to have abdominal pain and some symptoms you need to DKA, okay? So another thing that it says, like blurry vision and fruity odor to your child's breath. So that's another thing that's another unique thing that could be unique to diabetic ketoacidosis is fruity odor to your child's breath and blurry vision. So if you guys get this question, especially if it's like all that apply, I know you guys will get it right, okay? So let's move on to the next question if we don't have any. Oh, so yeah. So I put this slide up so that you guys can see the difference between diabetic ketoacidosis and HHS, okay? HHS stands for, I always forget the name of it because it's like so long, okay? HHS stands for hyperosmolar hyperglycemic syndrome, and it's a serious complication of diabetes mellitus. HHS occurs when the person's blood glucose sugar levels are too high for a long period, okay? So I wanted to give that explanation point, that extra slide, so you guys could know the difference, okay? So why am I putting this slide up? I'm putting this slide up so you guys can understand the difference between diabetic ketoacidosis and HHS, otherwise known as hyperosmolar hyperglycemic syndrome, okay? So I want you guys to, before I even get into it, I want you guys to automatically remember DKA, you're going to think type 1. HHS, you're going to think type 2, okay? So for diabetic ketoacidosis, we already went over this. Is you're going to have your hyperglycemia, meaning the blood glucose is up there, and it's going to be ketotic, meaning there's going to be ketones in the body. We talked about that. It's acidic. So both DK and HHS is when the blood glucose levels is high. One of them is prominent in type 1 diabetes and the other is prominent in type 2 diabetes. So the pink one, DKA, when somebody with type 1 diabetes has very high blood glucose levels, they are going to present with symptoms of diabetic ketoacidosis 9 times out of 10 on NCLEX, okay? So you're going to see metabolic acidosis, you're going to see them have ketones, you're going to see them have hyperglycemia. So know this for certain. HHS, okay? So I'm not going to say the word again because it's like so long, but HHS is you're going to see it in a patient with type 2 diabetes mellitus. When the blood sugar is super high, you're going to see hyperglycemia, you're going to see high serum osmolality, and you're going to see absence of significant acidosis. Absence means you don't see it, okay? So you're not going to see a lot of ketones in the blood and stuff like that, but you're going to see high serum osmolality and hyperglycemia, but both are very serious, okay? So don't think that one is less serious than the other. Both are very serious. I like to think DKA is more serious. From the questions I would get on nursing school and I think DKA is more serious, but you just have to know like the difference between them, okay? All right. So let's go to the next question. So the next question says, the dietitian is giving a class on various therapeutic diets. Which therapeutic diet would be the best for a client with acute renal failure? Okay, so we're talking about therapeutic diet and acute renal failure. Already established what was acute renal failure. Renal failure, ARF, acute renal failures. Renal stands for kidney, acute stands for abruptly, renal. So the patient has the kidneys is giving up on them right now. What kind of diet would you give to a patient where their kidneys is failing them right now? Is it A, high potassium and low calcium diet? Is it B, a low fat and low cholesterol diet? Is it C, a high carbohydrate and restricted protein diet? Is it D, a regular diet with 6 small feedings a day? So before I answer this question, I want you guys to think about what is the function of the kidneys, okay? What is a normal function of the kidneys? And if the kidneys is not doing that function, what can't the kidneys do? What would aggravate a diseased kidney? What kind of diet would aggravate a diseased kidney? And what kind of diet would be prescribed for that patient? So I'm gonna let you guys look at this question and answer. Let's see what you guys say. It's really hot. I don't know why I have my heater on. What would you guys say? Okay. Claiborne Mathis says she put B, low fat and low cholesterol diet. Okay. Anyone else? Don't forget to hit the like button as you guys come in. Woo, thank God I turned off the heater. It was really hot. It's like 80 something degrees. All right, so let's see the correct answer. So the correct answer would be, it's actually C, a high carbohydrate and restricted protein diet. Okay, Miss Mathis, let's discuss why that was wrong. So the first thing I want you guys to look at is the function of the kidneys, okay? So I put this diagram here to help you guys understand a little bit. So it basically shows a nephron and how unfiltered blood enters the kidney, okay? Nephrons in the kidney filter the blood. It removes toxins and waste from the urine, and out there, it filtered clean blood leaves the body, right? So why is it high carbohydrate and restricted protein diet, okay? So the reason why it's high carbohydrate and restricted protein diet, from now on, when you think a patient with kidney disease, you're going to think no protein, no protein. Okay. It's one of those matchy things. No protein. Okay. So the reason B is that protein is one of those things where if it's not cleaned out in the body, it can develop toxins in the body, okay? And the patient with acute renal failure will also need high carbohydrate to get their calories, okay? Because you have to remember, the patient still needs calories, and those calories will come from carbohydrates because carbohydrates are usually very high in calories. That's why anytime you see a weight loss diet, they always say, oh, cut out the carbs, because they provide a lot of calories. And we want calories for our patient with acute renal failure because they are going to be on a restricted protein diet, okay? So because protein is one of those elements in the body that you need a very good kidney. You need a good kidney to remove protein, like excess protein from the body, because excess protein can cause an accumulation of waste in the body, okay? So these are one of those things you just have to remember. Acute renal failure, you always know that anytime you see a patient with kidney disease, you know that they are restricting their protein. Always remember that. Anytime you see a patient with, like you see, when I did this question, honestly, I didn't look at the high carbohydrate, but I saw restricted protein and I automatically knew, okay, restricted protein. I already knew it was acute renal failure because I know patients with kidney disease, they don't tolerate protein very well because it's too much for them. Their body's not able to break down protein. You know, that's why they always say, like, if you're taking protein shakes, like people who take protein shakes, like people who are into like athletes and stuff, they have to be careful not to take too much protein because that could actually damage the kidneys. Did you guys know that? Too much protein, like if you're an athlete, if you're working out, like I'm not saying don't drink protein shakes, but if you drink too much of those protein shakes, like you're always drinking protein shakes, morning, noon, and night, you can actually damage your kidneys. Look this up, guys. I'm not making this up because protein it takes a lot of work to break that down, okay? So we want the patient to have a restricted protein diet, and we want to have a high carbohydrate to supply those calories, okay? So we're not gonna, let's see if, because I'm not seeing your comments now. Oh, hey, Brandy Jones. Brandy Jones says A. Okay, yeah. So yeah, Claiborne Matt says I need to brush up on renal failure. It has been a while. Yeah, that's okay. So actually, I usually open my phone. Let me open this too so I can see your comments on here so I don't have to keep doing that. So I can see your comments on here. Okay, so yeah, so Brandy Jones, it will not be A, which is high potassium and low calcium diet, because, you know, you have to think about it. Like, if you think about it, I mean, potassium, the patient can't filter the waste out their body anyway. So like 9 times out of 10, they probably have high potassium in their body anyway because they're not filtering stuff out. So you wouldn't want high potassium because that's going to aggravate the situation. And a low calcium diet, you wouldn't want that either. B, low fat and low cholesterol diet. Yeah, that would be more so if the patient had a coronary artery disease, like if they had a heart issue. Like when you see low fat, low cholesterol, as soon as I think low cholesterol, I think an artery and plaque covering it. And if you have a lot of plaque in your artery, the blood can't flow as easily. So when I think of low fat and low cholesterol, I want you guys to always think of like, okay, this patient could be, that could be a cardiac diet, because, you know, with cardiac diet, you always want low cholesterol, low fat diets, right? And that could be a diabetic too, right? A regular diet with 6 small feedings a day. That's just, you know, No. So the main thing that they're looking for is that you know that a patient with kidney failure, patient with kidney disease, you want to restrict the protein in their diet because, like I said, protein is very hard to break down, and that is why you need to restrict that protein, and you need high carbohydrate because they need those extra calories. But like I said, when I first answered this question, I said restricted protein. I already knew kidney disease. Okay. So let's go to the next question. If anyone has any questions on this question, speak now or forever hold your peace. It's okay to make mistakes. Now you know. Kidney disease, restricted protein. Okay? All right. So the next question says, a patient has had diabetes for 20 years and has noticed that he has decreased sensory perception in both of his legs. Okay? Which action should a nurse do first? I'm gonna wait for you guys to give your answer. Is it A, test the sensory perception of the client's hands? Is it B, document the finding as the only action? C, tell the client that he now has peripheral neuropathy? And D, examine the feet for manifestations of injury. Okay, so right away, I'm going to give you guys a good tip. In test questions, it is very, very unlikely that it's going to be an absolute answer. And what do I mean by an absolute answer? An absolute answer is when you see keywords like only, always, or this. Sometimes you do see it like it could be a flexible rule, but in general, anytime you see only and like anything that's like absolute, like always, usually it's wrong because they want you to critically think. Okay. And plus, like if a patient has decreased sensory perception in both his legs, who's just going to write it down and then that's it? Okay. No one's going to do that. Right. Okay. The patient comes to you saying, oh, I have decreased sensory perception. I can't feel stuff in my legs. Okay. Write it down and that's it. Like, no. Okay. All right. So Claiborne Mathis says D. Brandy Jones says D. Okay. That's very good. The answer is D. The answer is examine the feet for manifestations of injury. Very good. Brandy and Claiborne, very good. Okay, so what is sensory perception? So the first thing you guys have to do to break down this question is you have to understand what sensory perception is. Sensory perception just means like you have feeling in your legs, like you could feel your legs, okay? Keywords are diabetes. You have to know like what is diabetes. The patient had diabetes for 20 years. That's a long time. Okay, for 20 years. And now he realizes that he has decreased sensory perception in both of his legs. Like he can't feel both of his legs like he used to. Which action should the nurse do first? Okay, I remember we did a question like that before. Okay, so test the sensory perception of the client's hands. Why would that be the first question, the first action you do? The question is asking you about the legs, so you will not test the hands because there's nowhere in the problem where they're talking about the hands. So that's a no. B, document the finding as the only action. Like I said, absolutes are usually a no in question in answers, and you're not gonna just write them down and that's it. Because you're a nurse, you're supposed to do something after. You're supposed to implement something. C, tell the client that he now has peripheral neuropathy. Peripheral neuropathy is basically neuropathy. You have to look at the keywords. Pathy means disease, neural, nervous system. Peripheral means like arms, legs. You're not a doctor. He could have peripheral neuropathy. 9 out of 10 is probably true because the patient has diabetes, but you're not a doctor. You're not going to tell the client, oh, well, now you have. No, you're not a doctor, so you're not going to tell the patient what he has because there has to be tests. There has to be a series of steps to be performed before you can tell the patient, oh, they have peripheral neuropathy, okay? So, but if you chose that, Now you know not to choose it. So the answer is D. Examine the feet for manifestations of injury. And I put this. Remember, patients who have diabetes have compromised circulation. Okay, it can damage the nerve as well. Okay, remember, sensations are decreased. So I want you guys to always remember this. Patients who have diabetes, I said that in our last I said that in the last live last Sunday. Patients who have diabetes have compromised circulation. Okay, so what does that mean? That means that, okay, so patients who don't have diabetes, like let's say a normal healthy person, um they have insulin. We already know what's the job of insulin. Insulin brings sugar into the cells, glucose into the cells so that the cells can use it, and they have good rate circulation. But you have to remember, patients who have diabetes, their circulation is not as good as ours. Okay. And it can also damage the nerves as well. So that's why it's so important, if somebody has a diagnosis of diabetes, or if they suspect that they need to go to their doctor and get tested for diabetes, and get tested for their sugar, because if they don't, there are some people who go years, and this point is gonna bring it on home for you guys, so you guys could understand. There are some people who go years upon years and they do not know they have diabetes. They have the symptoms, it's probably mild, and they go years and years like eating the same way they do, not noticing that they have diabetes, especially if it's diabetes type 2, because diabetes type 2, like some people can like not even notice. They could go years and years without knowing it, and then they could all of a sudden, sometimes they could become blind, because you have to remember, the retina, there are nerves in the back of your eye, and you need those nerves to see, and diabetes can affect the eyes. Diabetes can also affect blood circulation. So that's why the way they sense things, their sensory perception is not the same. That's why when you say the feet, they always have to watch their feet. And I'm gonna get to this in a second. But I just wanted to give that story, to bring it on home, how diabetes can affect the nervous system, and it could affect the circulation as well. Okay, so I put this slide up to bring this on home. It says managing diabetic foot infections. I just want to put it on home so you guys could remember, so you guys could think about it. So this is a picture of a patient who has diabetes, their foot, and what can happen. And you know why it could happen? You guys could say, well, dang, like if the patient is not bedridden, how could it go into stage 4? Yes, it could go into stage 4, because the patients who have diabetes, they don't they don't have the same sensations as patients who do not have diabetes, as normal healthy people. So they can go days and days with the ulcer, with the ulcer, and not even notice it, because they can't feel it. It's basically what I'm trying to say. So I hope that this picture brings it on home, so you guys know why the answer is D. Examine the feet for manifestations of injury. Because if the patient has no sensation in the feet, this patient, it's like, oh, I can't feel my feet. If the patient says that, then chances are they may have an injury to their feet like this one, because they can't feel it. So that's why exactly, yes, Chris Kai, diabetic foot ulcer, yes. So that is why when you have your patient who has diabetes, you always have to educate them to wash their feet properly. Okay, you have to educate them to dry between the toes and always check their feet. I'm telling you, when it comes to NCLEX, and when it comes to Kaplan, yeah. When it comes to NCLEX, and when it comes to nursing school, and when it comes to real life, you always have to remember that they want to see that you're educating your patients who have diabetes on foot care. That is so key, guys. You're going to see that question 9 times out of 10. Okay? So, next question. I hope that brought it on home. I hope that brought it on home that you guys understand that patients who have diabetes have slows circulation and decrease sensory perception. So it affects the nervous system and circulation. Okay, that's why we have to manage their diabetes correctly. Next question. You are the RN working with an LPN, a UAP, which is unlicensed assistive personnel, and sorry guys. It's supposed to say, and another nurse, or that's fine. Just omit the okay? So which nursing task can the nurse delegate to a UAP, unlicensed assistive personnel? So I want to let you guys know you definitely going to see those questions on your NCLEX. Whether you are preparing for your LPN or RN, it doesn't matter, because if you are taking the NCLEX RN, your question will read, you are the nurse working with an LPN, UAP, and probably another nurse. Which nursing task can you delegate to the UAP? And then if you're LPN, the question may read, you are the LPN working on the MED-SERG unit. Which assignment would you accept from the RN? So it really doesn't matter whether you are sitting for your LPN NCLEX or your RN NCLEX, because they're both trying to see, do you know people's scope of practice? Now, this could be kind of tricky. In fact, when I was studying for the NCLEX, I got some of those questions wrong, like a lot of those questions wrong in UWorld, because I was just thinking about my LPN experience. I was like, oh no, CNAs can't do that. CNAs can't do that. But don't think like that. Don't think CNAs, just because you work in nursing home, CNAs. Unlicensed assistive personnel can be anyone. It could be a medical assistant. A medical assistant don't have a license. CNA doesn't have a license. Any kind of like assistant doesn't have a license. So you can't automatically say, oh, well, I work in a nursing home and I never see CNAs check their blood glucose. That could be, that could be present in another situation, okay? So what would the answer be? Okay, I already see some answers. Brandy says D. Let's put your answers up. Brandy says D. Claiborne Mathis says D as well. Let's see the answer. Okay. So is it A, evaluate the client's 12-hour intake and output? Can an unlicensed assistive personnel do that? Can they evaluate the client's 12-hour intake and output? So for those of you guys who know intake and output, intake is like what the patient eats or drinks, or if they intake IV fluids, right? Anything they're intaking in their system. Output is anything they like basically pee, urinate, pee and urinate, same thing. Urinate, anything they urinate or anything they feces, that's output, right? So evaluate the client's 12-hour intake and output. Can a UAP do that? Assist in checking a unit of blood prior to hanging. Can a UAP do that? Administer a cation exchange resin enema. Can a UAP do that? Or D, collect a clean voided midstream urine specimen? Yes, guys. Woo! Brandy Jones and Claiborne Mathis, you guys were correct. The answer is yes, it's D. Collect a clean, voided midstream urine specimen. Okay. So back in the day, I would probably think that was wrong, because I see midstream, like, no, wait. No, because that's a urinate and stuff like that. I want you guys to remember this. Remember. Oops. Okay. Remember, legalities. RNs get most critical patients. So that's just with delegation. RNs always get the most critical patients. The most sickest patients you can find, the RNs will always get that. Always remember that. LPNs always get the most stable patients, okay? And I also put, do not delegate what you can eat. So this is an acronym everybody should know. Anything that you can evaluate, assess, and teach, do not delegate it. So just memorize that, okay? So that means evaluate the client's 12-hour input. You already see the word evaluate. You already know that's not going to be it. Okay. Assist in checking unit of blood. Blood is only RN. Blood is only RN. It's only RN. It's only RN. So we're not going to give this to unlicensed assisted personnel. Administer a cation exchange resin enema. You know what? I wasn't even 100% sure what that is. I had to Google that to find out. But I don't even have to know what that is. I already know, like, anytime you're administering medications and treatments such as enemas, that's always the job of the nurse. But collect a clean, voided midstream urine specimen? Yes. A UAP can do that. Even if it's midstream, you could just teach them how to and they could do it. Because it's not a task that involves nursing judgment. So that's why we could delegate that. Okay. So next question says, you are the nurse working in the emergency room. Your patient comes in with a gunshot wound to the abdomen. Which nursing intervention should the nurse implement first to prevent acute renal failure? Okay, so I want you guys to put your put your answers down below. Okay, let's see what you guys come up with. Don't forget to hit the like button. Okay, Brandy says A. Claiborne says A. All right, guys, the answer is A. Woohoo! Okay. The answer is going to be A. Good job, guys. So this nursing intervention would prevent acute renal failure because you have to remember, I just put a IV of 0.9 sodium chloride here, just like a picture, just to get your mind flowing. So I said renal failure can occur due to decrease in perfusion of blood to the kidney. So administering fluid is key to restoring circulation. So the basic thing is, if a patient comes in with a gunshot wound to the abdomen, I want you to automatically think gunshot wound to the abdomen. Think of any of those like Grey's Anatomy or any of those shows that you have watched when a patient has a gunshot wound. That means blood everywhere. There's blood everywhere. And, blood is life. So the patient is already losing so much blood. So what happens to a patient when they lose so much blood? They could go into shock because blood is needed for all your organs to work properly. All of your organs need blood. Why? Because blood carries oxygen, so on and so forth. Okay. So why would a patient who have a gunshot wound, who is losing a lot of blood, get acute renal failure? Why would a patient who has a gunshot wound be at risk for their kidneys giving out on them? Okay, if it's in the abdomen, what does it have to do with the kidneys? It has a lot to do with it, because if blood, especially the abdomen is very vascular. If blood is being released from the abdomen, and that means it's not going to perfuse to every part of the body. That means the kidneys can be left with nothing. Okay, so anytime if the kidneys are not being supplied with enough blood, then the kidneys can't do their job. So that is what will cause the kidneys to go into failure, because the kidneys do not have enough blood supply, and that's what caused the failure. So the correct thing to do is to administer normal saline IV. Why? Because the normal saline IV will put back the normal volume of fluid that the body needs to function, which is being lost by the blood right now. And then that will in turn make the kidneys work correctly. Okay, I hope that makes sense. It wouldn't be place client on telemetry, because you have to see what is the key word. It says, what would the nurse implement first to prevent acute renal failure? Okay, so take vital signs. No. Okay, I know we always think, oh, assessment, but this is not an assessment question. This is an emergency question. It even says that it's an emergency room. The patient has a gunshot wound. You wouldn't take vital signs first thing. If you see the patient is losing a lot of fluid, you want to prevent acute renal failure, you're going to administer normal saline IV, because that will immediately stop the acute renal failure, because all that see that big bottle of normal saline, that will go into the body and that will restore circulation. That will help restore circulation. Okay. So place contact telemetry, no. Assess abdominal dressing, no. That has nothing to do with kidney failure. Looking at the abdominal dressing, that has nothing to do with preventing the kidneys from shutting down. If you want to prevent the kidneys from shutting down, you want to administer normal saline IV so that enough blood is perfused to the kidneys. Okay. It's as simple as that. Okay, so I put this here. I said, renal failure can occur due to decrease in perfusion of blood to the kidneys, so administering fluid is key to restoring circulation. So my main goal is that I want to restore circulation back to my patient by giving them IV fluids so that they do not go into acute renal failures. Taking vital signs is not going to prevent, it's not going to be the first action. No, I want to fix them quickly, so I'm going to administer normal saline, okay? So anybody can have any questions? Okay, please hit the like button as you guys come along. Okay, we are in 1 hour and 30 minutes now. Wow. Okay, we are learning today. Next question is, your patient is coming with an admitting diagnosis of diabetic ketoacidosis, okay? So those guys who were there before, remember we did a whole lecture, I did a whole explanation on diabetic ketoacidosis. If you haven't seen it, don't worry, when this video closes, you will see it. Okay, the nurse should anticipate that the doctor will order which of the following? Diabetic ketoacidosis, okay? Are they going to administer glucagon and IV fluids? Are they going to administer glucocorticoids? Are they going to administer insulin and IV fluids? Or are they going to administer blood products? So looking at the answer choices, I already know that glucagon is sugar. Okay? Glucocorticoids are those hormones that can raise the blood sugar. I believe it's from the adrenal cortex. Insulin decreases blood sugar, and blood products restore the blood. Right? So what will be the answer? I'm going to let you guys give me the answer before I give it away. Nobody knows? Oh, wow. Nobody wants to take a guess? Okay, so I'll help you guys think through this. Diabetic ketoacidosis, like we said before. Oh, Claiborne Mathis says A. Okay. Brandy Jones Wilson says A. Okay. Okay. So everybody says A. Okay, so all right, so I'm gonna help you guys think through this, okay? So your patient is coming with an admitting diagnosis of diabetic ketoacidosis. So the first thing you guys have to think of is, what is diabetic ketoacidosis? Remember that chart that we said? Let's go back. That chart that we said, diabetic ketoacidosis is seen in type 1 diabetes when the blood sugar level is very high, okay? And we know that type 1 diabetes means that the pancreas, the beta cells, the islets of beta cells in the pancreas is not producing any insulin at all. So if no insulin is being produced, that means that blood sugar is going sky high. Okay, so we already established that. Diabetic ketoacidosis is when there is a lot of ketones in the body. So because the blood sugar is very high, the body is releasing a lot of ketones. So the body is very acidic. So basically with diabetes, polyuria, polydipsia, polyphagia, the 3 Ps. Increased urination, the body is going to want to pee all that urine out. Okay, but along with that urine, you're going to see the body's going to want to pee that sugar out. But along with that sugar in the urine, you're going to see other essential elements that we need to survive, like potassium, sodium, all those elements go out in the urine as well. So the patient will be dehydrated. And because the patient will be dehydrated, they will be thirsty. So that's polydipsia, increased thirst. And then because all that glucose is leaving the urine, they're going to be hungry. Because if your blood sugar is low, that's going to cause you to be hungry. So the blood sugar is not necessarily low, but because the glucose is exiting the body through the urine, it's gonna cause you to be hungry. Okay. Oh, Brandy says that makes sense. Okay, good. So the patient will have weight loss and flu-like symptoms, right? So now we know what DKA is, right? So we know what DKA is. I want to be careful because I don't want to give the answer. All right, so now we know what DKA is, okay? So we know our patient is coming with a mini diagnosis of DKA, so now we know what it is. So now that we know what diabetic ketoacidosis is, we know the blood glucose level is sky high, okay? Which of the following? Is it glucagon and IV fluids? What is glucagon? This is how I study. Quickly, Google. I have my phone right here. I'm going to show you guys. I literally Googled, what is glucagon? Glucagon is a hormone, and it says it can treat low blood sugar. Right there on Google. Okay? So, if glucagon is used to treat low blood sugar, that means glucagon is going to make the blood glucose levels go up, right? Because as you guys see, the drug class is a hyperglycemic agent. So it can treat severe low blood sugar. So if something is a treatment for low blood sugar, what do you think it's going to do? It's going to bring that blood sugar up. A patient who has diabetic ketoacidosis already has sky high blood sugar. So if we give glucagon, which is used to treat low blood sugar, to a patient with diabetic ketoacidosis who has high blood sugar, what would that glucagon do? That glucagon will kill the patient because the patient who has diabetic ketoacidosis already has a high amount of sugar in their body. Glucagon will add more sugar in their body. So we're not going to give glucagon and IV fluids, okay? Does that make sense, guys? I hope it makes sense to you. If you don't understand, please say it. But that is basically what it is. Diabetic ketoacidosis means the blood sugar is sky high, emergency sky high. Patient can die because the blood sugar is too high. Glucagon is used if the blood sugar is very low, because glucagon is meant to Okay, thank you. Tiffany Hubbard says yes. Claiborne says yes, that makes sense. I'm so happy. So that's good. So the main thing you guys have to understand, to know is what is diabetic ketoacidosis. You already know that blood sugar level is sky high. And what is glucagon? What does it treat? Glucagon is a hormone that puts sugar back into the body when the patient has low blood sugar. Now, it's okay. It's easy to get that mixed up. Oh, you're welcome, Brandy. Mwah. You're welcome. Said thank you for breaking it down. You're welcome. Oh, that's so sweet. Tiffany Hubbard says, I'm about to start working on a diabetic renal unit. Okay, that's cool. Congratulations. I wish you all the best, Tiffany. Okay, so B, why is it not glucorticoids? Well, I remember this out of the top of my head, but if you don't remember this, that's what you do. You Google it. I'm telling you, this is how I remember it. This is how I studied. If I didn't understand something and the explanations wasn't right then and there, I just Googled. That's why I loved UWorld, because, and I always studied with study mode. I never studied with like just test mode because I would want the explanation right there. Okay, it says glucocorticoids are a type of corticosteroid hormone that is very effective at reducing inflammation and suppressing the immune system. Okay, so steroids, so it's a steroid. Steroids always increase the blood sugar. Always remember that. Always remember that. Steroids always increase the blood sugar. I remember just recently, last week, I was working with one of my CNAs, and I think she had lupus, and she wasn't feeling very well. She was feeling very lethargic. Her blood sugar was sky high, and she told me that she doesn't have diabetes, but for her lupus, she was on some steroids. And because she was on steroids, unfortunately, she had steroid-induced diabetes. So steroids does raise the blood glucose levels. Glucocorticoids is a type of corticosteroid hormone. Okay, they reduce inflammation, but unfortunately, steroids increase the blood sugar. So it's not going to be that. You're welcome, Tiffany. Okay. C, insulin and IV fluids. What do you guys think about C? What do you guys think about C? Do you guys think would you give insulin and IV fluids to a patient in diabetic ketoacidosis? What do you guys think? Diabetic ketoacidosis, blood sugar is sky high. Yes, you would give insulin to a patient with diabetic ketoacidosis, because what does insulin do? Insulin takes that blood sugar and pulls it back into the cells. That's basically what it does. Insulin takes blood sugar and puts it. Yes, good job, Brandy. Good job, Claiborne Mathis. Yes, so insulin takes the blood sugar and pulls it back into the cells. So that's why would they get insulin. Now let me ask, so it's like a test. Why would we give them IV fluids though? Because this could be a select all that apply. They may not be in the same. Why would we give a patient with diabetic ketoacidosis IV fluids? Can anyone say why? What happens in diabetic ketoacidosis? Why would they need IV fluids? Think about it. The 3 P's of high blood sugar: polyuria, polydipsia, polyphagia. What do they mean? Polyuria, increased urine. Polydipsia, increased thirst. Polyphagia, increased hunger. Why would they need IV fluids? They would need IV fluids because remember, in diabetic ketoacidosis, very good, they are losing fluids. And why are they losing fluids? I want you guys to understand why. You want to know why? You have to understand why, because I want you guys to know the content. okay? Because if this question is flipped into a select all that apply, I want y'all to be ready, okay? So if your nursing instructor passes you that question in a different format, like, oh yeah, I know it. It could come at you at any different way, and you will already know it because you already understand the reason why. So yes, a patient with diabetic ketoacidosis will receive IV fluids because diabetic ketoacidosis patients are always dehydrated. Remember that. They are always, yes, very good, Tiffany Hubbard. They are always dehydrated. They are always dehydrated because the body is trying to remove all that urine, all that sugar from the body through urine. But along with that sugar going in the urine, there's electrolytes going there. There's all kinds of fluids leaving the body. So the patient is severely dehydrated. So we're going to give insulin and IV fluids. I never forgot when I was working in the clinic, one of the doctors that was working there, he was giving his medical students actually this lesson, and he was talking about the specific insulin. I think it was regular, don't quote me, I think it's regular insulin and normal saline. Like, he was just talking about that, and it's such an important topic to talk about because in the emergency room sometimes you will see patients with diabetic ketoacidosis. Okay, so it's so important. Like, even medical students, the doctor had to break it down to them, I think they weren't really medical students, they were in their residency, so everybody needs that refresher. If you don't get it, it's fine, but it's one of those topics, like, it's good to know. Okay, so I put this. So why order insulin? Okay, I said normal blood sugar is less than 140. Okay, in diabetic ketoacidosis, it can rise as high as 400. So I said the sugar has to go somewhere. So where does the sugar go? The sugar goes in the urine. Okay, so I know I sound repetitive, but let me tell you guys something. When you repeat something, you get it, you know it, and you will never forget it. All right. So yes, guys, make my New York come out. All right. Next question. I put, so why administer fluids? Okay. So I put, in diabetic ketoacidosis, remember, the ketones make the urine very acidic. Okay. If your body has a lot of acid in it, like, that's not the normal pH, the body's not used to that. Okay. So what does the body usually do? It tries to get rid of that by itself. Okay. The body is like self-healing in that way, right? So how does the body try to self-heal itself? It gets rid of it through vomiting. So you're going to want to vomit. You're going to want to throw up. Okay. So symptoms of diabetic ketoacidosis, you're going to have nausea and vomiting. You're going to have fatigue because, all that fluid is leaving your body is going to make you tired. You're going to have, not you, but the patient's going to have weight loss. Okay. In diabetic ketoacidosis, remember, you see diabetic ketoacidosis in type 1. Okay. Type 1 patients who have diabetes are always skinny, right? Not always, because there's no such thing as absolutes, but 9 times out of 10, they always have weight loss. They're going to be hungry because all that glucose is leaving their blood, their urine, through the urine. Increased urination, abdominal pain, they're going to be thirsty, they're going to be drowsy. So that is diabetic ketoacidosis. Okay, so I want you guys to, like, this is not a picture where you're going to, like, write down. Like, I want you guys to get out of the habit of, like, writing down, because, like, when you think about it, NCLEX is a national exam. So which textbook are we using? Are we using this textbook from this school or this textbook from that school? No. In NCLEX, you have to know, like, the standard things, right? So that you have to know, like, you have to understand the pathology so you could answer the question. So you could get a select all apply. So that when you answer select all apply, you're not always so scared, because there's no reason to be afraid of select all apply, because it's just the principle. Okay, you already know diabetic ketoacidosis, the patient is dehydrated. What are symptoms of dehydrated? Have you ever been dehydrated in the hot sun? You're going to feel drowsy. You're going to feel thirsty. You're going to feel hungry. You're going to feel increased urine. Well, no, not increased urine. You're going to feel fatigued, all right? But in diabetic ketoacidosis, keyword keto, there's ketones. Ketones are acidic. The body's going to want to get rid of it. You're going to vomit, okay? And when you're throwing up, it's going to make you tired. The patient's going to have weight loss, increased urination, the 3 Ds in high blood sugar levels in patient with diabetes, polyuria, increased urination, polydipsia, increased thirst, right? Polyphagia, increased hunger. So increased urine, increased thirst, increased hunger, right? That's all it is, guys. You just have to understand the concept. Okay, so I said the body tries to get rid of all the sugar through the urine. However, along with the glucose that is released, urine, water, salt, and potassium released. Okay, so I put in exclamation point. Patients losing extra water and electrolytes. Okay, I'm gonna give you guys a short story, very short story. There was a time where I was dehydrated one time because I was working in the clinic and I was just dehydrated. And long story short, I had to go to the ER. No, I didn't go to ER because I was dehydrated before, and I could tell when I'm dehydrated, I was very dizzy and lethargic, and dehydration is a serious thing, guys. It can happen to anyone. So water and electrolytes are important. All right, next question. Your patient has chronic kidney disease and has just came back from having an arteriovenous fistula inserted in the left forearm. Which nursing intervention should the nurse follow? Is it A, perform all laboratory blood tests on the left forearm? B, remind the patient to, it says, it's supposed to say to, sorry guys, to never perform hand exercises, teach the client to carry heavy objects with the right arm, or D, instruct the client to lie on the left arm at night? Which one would you choose? Which one would you choose? I can't wait to do my hair on Wednesday. What would be your answer here? Okay. Brandy Jones says C. Let's see the answer. Oops. Claiborne Mathis says C too. Okay. The answer is C. Say C is say. C is teach the client to carry heavy objects with the right arm. Okay, so the arterial, the fistula for a patient with kidney disease, the fistula is put in so that when the patient goes on dialysis, that's where they take the blood to clean it out and then put it right back. So you would teach a client to carry on heavy objects on the right arm. Okay, so patients who have fistulas, you're going to want to avoid taking blood tests on that arm. You're going to avoid lying down on that arm because it's a fistula, So a fistula is basically I know what it is, but what is a fistula? I have the image in my head. Okay, it's a connection between an artery and a vein. Okay. So that's what a fistula is. So when you have that connection, made, you're going to want to avoid carrying heavy objects, okay? Because that can disrupt the circulation to the arm and that can cause a clot, okay? So undue stress is a no-no, okay? You want to remind the patient, the B says remind the patient never perform hand exercise. The patient can perform hand exercises because that has really nothing to do with the arm because it's right here. And it says instruct the client to lie on, like you're not going to lie on left arm. So basically when it comes to a fistula, you just want to avoid all of this area. So you're not going to want to perform blood tests. You're not going to want to lie on the left arm. You're not going to want to carry heavy objects. Okay, so that's why you would do C. You guys are correct. Teach the client to carry heavy objects on the right arm. Okay, because like I said, it could disrupt the circulation, causing a clot, and that's undue stress, and that's a no-no. All right, so I put this patient education when it comes to good fistula care, okay? So good fistula care will help maintain the patency of the vascular access, okay? Education is actually the responsibility of the nurse, so you're going to want to check the thrill at least once daily. You're going to want to avoid tight clothing, jewelry, or a watch. Avoid carrying heavy objects. Avoid exposure to extremes of heat or cold, okay? When a patient have a fistula, you just want them to leave that area alone. Don't try anything. Don't try to carry heavy stuff. Just leave that arm alone because we want that vascular access to become patent, because we don't want them to go through that whole thing again of surgery to combine an artery and a vein, okay? We want to keep that vascular access patent so the patient can go on dialysis and all will be merry, okay? So hope you guys understand that. And that's just, like I said, you don't have to memorize this. It's just almost like common sense. Just leave it alone, leave it alone. Don't do too much to it. Okay. But yes, you guys are correct. Okay. We're almost done here. We're almost at 2 hours. Okay. The nurse is providing education to a patient with type 1 diabetes mellitus about sick day rules. Which of the following information is appropriate to include? This is actually the last question, guys. We always go right at 2 hours. Okay. The nurse is providing education to a patient with type 1 diabetes mellitus about sick day rules. Which of the following information is appropriate to include? What would you guys choose? If nauseated, seize all oral intake. So don't take anything by mouth if the patient feels like they want to throw up. B, monitor blood glucose at least once a day. C, do not take insulin until you feel well. D, drink 8 to 12 ounces of fluid each waking hour. Which answer do you guys think is correct? I'll wait for you guys to give your final answers to this final question. You guys have been doing so well. Okay, Clay Mathis says B. Monitor blood glucose at least once a day. Any other answers, or do you guys all think it's B? You guys all agree with Claiborne Mathis? Okay, Brandy Jones says D. Drink 8 to 12 ounces of fluid each waking hour. Okay. So we got a B and a D. All right. So, all right. We're talking about, okay, the nurse is providing education to a patient with type 1 diabetes about sick day rules. So we already know what type 1 diabetes mellitus is. We talked about it before. Brandy Jones says no D. Okay. So what do you think it is? LOL. Okay. So we already talked about what diabetes mellitus is, right? We used the analogy of the house with type 1. Type 1 diabetes means that I'm trying to paint this room, right? But I have no paint at all to paint it. And type 2 diabetes is I'm trying to paint this room. I have paint, but I don't have enough paint to paint this whole room. So that's why it's good if a patient with type 2 diabetes to lose weight so that they have enough paint to paint their whole room. Claiborne Math says caught between A and B. Okay. So with diabetes, guys, you have to know that there are sick day rules. Okay. So first of all, when a patient with diabetes, either type 1 or type 2, if they're sick, that causes stress in the body, right? And stress in the body causes the body to have increased blood glucose levels. So stress can cause increased sugar in the blood. Okay? So if the patient is sick, if patient with diabetes is sick, that can actually increase the blood glucose levels. So think about that. That's one thing, okay? So A says, if nauseated, cease all oral intakes. Okay, and we know that nausea is like you feel like you want to throw up, and says if the patient feel like they want to throw up, don't eat anything. Think about that. If nauseated, cease all oral intakes. Remember what we talked about absolutes, right? Even if you don't know the answer to this question, you already know that 9 times out of 10, absolutes are usually not right, because that means if you're nauseated, you don't even drink water, right? Think about that. Okay, B, monitor blood glucose at least once a day. So a patient comes to you and they have diabetes and they are sick. Are you going to tell that patient to, just check your blood sugar once a day and go home, right? Remember, being a nurse is all about being as safe as possible. These questions are set up in a way where they want to make sure that you're going to make sure that they want to make sure that you're being safe. So a patient is sick and they have diabetes, right? Are you going to tell them, okay, here, take this medication, and don't worry, just check your blood glucose once a day. Just like at 10 a.m. when you wake, I know you feel sick right now. At 10 a.m. when you wake up, take your blood sugar, and you don't have to take it at all for the rest of the day. What do you guys think about that? Okay. C, do not take insulin until you're feeling well. Some people may say that because they may feel like, oh, well, if they're sick, they're probably not eating, right? Or D, drink 8 to 12 ounces of fluid each waking hour. So in the process of elimination, what is it going to be? So it's not going to be A. It's okay, Brandy. Brandy said she was unsure about her answer. It's okay. So it's not going to be A because, number one, I personally, when I'm answering questions, I do not like to choose absolutes. Sometimes it will be absolutes, but that's very rare, very slim chance. But no, if a patient is not, you're not going to want to cease all in oral intakes. I mean, if I'm throwing up, I don't want to drink anything. But actually, if I'm throwing up, I'm losing electrolytes, I'm losing fluid, I'm going to want to take something by mouth because I'm going to be dehydrated. B, monitor blood glucose at least once a day. Okay, I'm sorry if I'm pronouncing your name wrong. Bunku said D. Okay, so B, monitor blood glucose at least once a day. So like I said, if a patient comes to you and they're sick, are you going to say, oh, just take your blood, and you know they have diabetes. Oh, just take your blood glucose at 10 a.m. and then you don't have to take it at all for the rest of the day. Just drink your tea, take your medicine, take your Tylenol, and then you'll be okay. You don't have to check it for the rest of the day. Would you say that to a patient who already has diabetes? Oh, Maria Treat Ace says B. But, okay. At least once a day. C, do not take insulin until you feel well. I mean, I understand that. I remember choosing that when I was in school. I understand that. Do not take insulin until you feel well because you don't know if the blood sugar is low, so don't take it until they feel well. Or D, drink 8 to 12 of fluid each while. Let's see who gets it correct. The correct answer is D. Drink 8 to 12 ounces of fluid each waking hour. So Akbunku, it was correct. Okay. So I put here diabetic sick day rules. Okay. So number 2 says continue feeding. Because remember, with diabetes, the reason why it's not C, meaning do not take insulin until you're feeling well, is that, remember, when a patient has diabetes, if they are sick, that sickness causes stress in the body, and that stress causes the blood sugar levels to rise. That's why you see patients who go in the hospital, if they have even type 2 diabetes and they're like, oh, no, don't give me insulin because I usually take oral diabetic medications like metformin or something. They give insulin because the body is stressed and stress causes increased blood sugar. That's why they give that insulin, right? So no, you're not going to want to, I know it sounds like a catch-22. Trust me, it was hard for me to wrap my head around it, but no, you're not going to want to do not take insulin until you're feeling well. You're not going to want to do that. You're going to want to take your insulin, that stems from number 7, give schedule insulin. Of course, if the doctor writes parameters, yeah, you're going to want to check those parameters, see the numbers, and go by that. Brandy Jones says, wow, well, I would have chose D. Yeah, it's okay. This one was a little tricky because myself, I'm being completely honest. When I was like in the beginning stages, maybe second quarter, I would have chose C, to be honest. Because this is how I would think about it. I'm not trying to confuse you guys. I'm just trying to show you that it's okay to think like that. Because I would think, okay, if a patient has diabetes, they're nauseated, they're sick. No, don't take insulin because insulin will drop the blood sugar levels and they're probably not eating because they're sick. But no, you have to understand the pathology of a patient who has diabetes. Patients who have diabetes, when they're under stress, that stress causes the blood sugar levels to rise. So yes, you're going to want to give the scheduled insulin because the blood sugar levels rise in the environment of stress. Okay? Monitor blood glucose at least once a day. You're going to want to check that at least 2-4 times a day or even more because like number 5 says, frequent blood sugar monitoring. Because if a patient has diabetes and they're sick, you want to constantly be checking that blood sugar level because they're sick. And remember what I said? If sickness can cause the blood sugar levels to increase in a patient who has diabetes. So you want to check and make sure that insulin you're even administering is even enough. Because now the body is in stress mode because it's sick. So you're going to want to monitor the blood glucose levels multiple times a day because the body is stressed, and stress causes the blood sugar levels to rise in a patient who has diabetes. Remember that. Okay, I hope that makes sense. I hope that's a story that makes sense because I think we remember stuff when it's like a story. So patient comes in, has diabetes, and is sick. You already know, oh, patient has diabetes, they're sick, they're under stress. That stress is going to raise that blood sugar levels. I better check that blood sugar level consistently multiple times a day, and I better administer the scheduled insulin. Yes, even if they're nauseated. A says, if nauseated, cease all oral intake. as number one says, you're going to want to prevent dehydration. Because remember, if the blood sugar is sky high because they're sick, what are the symptoms of hyperglycemia? Can we say the three Ds, right? Polyuria, polyphagia, polydipsia. When the patient is polyuria, urinating all that urine out, that's going to make the patient dehydrated. Okay? So we're not going to seize all oral intake, even if they're throwing up. It's one of, like, this is the thing. Yeah, I know it could be a little bit confusing, but it's one of those things where it's just the pathology of how patients who have diabetes, how their body responds to that. Once you understand it, that's all that is. Rest and avoid exertion. Check ketones. Why are we checking ketones? Can anyone tell me why are we checking ketones? Remember what we talked about before? Patients with type 1 diabetes, when their blood sugar is sky high, what do they have? They have diabetic ketoacidosis. Okay? What is the ketones? What are ketones? Ketones make the body so acidic. They're going to throw up. They're going to be throwing up. That could cause dehydration. So we're going to prevent dehydration. It's normal for them to be nauseated, but you're not going to want to seize all oral intakes. Anytime you see an answer where it says all, and that's like an absolute, 9 times out of 10, it's not the right answer. I'm not saying all the time, but 9 times out of 10, anytime you see an absolute, all, always, only, usually it's not it. Okay? That's so nice. Oh, we have a new person. Brandy is new. Thank you. Brandy says, thank you. This was so helpful. I have subscribed, shared, and liked. Can't wait until your next live. Oh, thank you, Brandy. Thank you so much for staying tuned. Oh, so I'm so happy you saw that. Did you see me from Instagram? Where'd you guys see the flyer? I would like to guys know, for those of you guys who are staying tuned, I wanted to know, like, where did you guys find this live? Did you guys see it in my community or Instagram or what? But yeah, guys, so that's why we're going to want to do that. We're going to prevent dehydration because the blood sugar is high. We're going to continue feeding. Yes, we're going to continue feeding them because they're already, we don't want to do that. They're already sick and we don't want them to be hydrated. We're going to treat the nausea. We're going to rest and avoid exertion. We're going to give them frequent blood sugar monitoring, check ketones, give scheduled insulin, extra insulin as needed, even extra insulin as needed. I know that could surprise people, but like I said, don't make that be a surprise because that surprised me. Remember, patients who have diabetes, they are in stress. Stress causes the blood sugars to rise. Sometimes they may need the extra insulin. And 9, know when to call the doctor. That's the end of the slideshow. Oh, okay. Claiborne Math says, I think YouTube recommended your past lives. Okay, I'm so happy to hear that. Okay. Let's see. It appeared on my feed. I was watching a lot of nursing videos. Wow, really? YouTube algorithm is helping me. Oh, hey, girl. Well, okay. Well, I'm surprised. You know what? I don't know why, but I always think the people on my live are the people who usually watch me. But thank you so much for staying tuned. My name is, maybe I should just start introducing myself, right? So I didn't introduce myself in the beginning because I don't know. I just always assume that the people who come to my lives are just the people who know me already. But I'm surprised. I'm so happy to have new people and my people who have always been rocking with me, the oldies but goodies, right? My name is Kimmy. So thank you, Brandy Jones, for coming. I'm so happy that you found it helpful in Claiborne Mathis. And my next live is going to be Sunday at 2 p.m. because I realized like this is just a great time to choose because I'm always off on Sundays anyway, because right now I kind of make my own schedule. But just to let you guys know, yeah, my name is Kimmy D. My name is Kimberly, and my channel is called Kimmy D TV, and I started it years ago when I was an LPN, And I just graduated with my RN in November. And then I think I graduated like the first week of November, and I took my NCLEX like the last few days of November, and I got my RN by the grace of God. And I just make videos about like nursing career, and I just recently started making videos about how to pass nursing school because I noticed that there was a need in learning how to pass nursing school, not just NCLEX but nursing school, and just trying to change it up. Yeah, so I hope you enjoy my content here. I did graduate as valedictorian of my RN school. So I feel like I can teach people how to think, how I think, to make me pass nursing school with a high GPA, and also pass NCLEX RN and NCLEX LPN with the least amount of questions. I feel like there are very good professors. But at the same time, I feel like, unfortunately, there are some professors that, don't, some professors don't really care or don't have the time to like sit down and break down how to think through it. And throughout my nursing career, my nursing education career, I've always used additional resources. So I am working on a course currently to help you guys succeed in nursing school. And I hope that, it will be helpful to you guys, because to be honest with you guys, I barely used my PowerPoints from nursing school. Like when I got a test, I rarely used my PowerPoints. I fished information from this place and that place and that place and this place. So what I'm doing is creating a course where you'll find everything in a one-stop shop, and trying to explain it in a way that breaks it down. Because when I asked questions in nursing school, people thought I was stupid, I was dumb. Like they were like, "Oh, why are you asking questions? You still don't get this?" And I felt really bad at the time. I didn't really feel bad. I was like trying to control my emotions, but like I just felt like, dang, like why do people have to make me feel bad for asking a question? And then on top of that, I'm not going to say the word because like YouTube flags certain stuff. But on top of that, when the health situation happened, I was in the midst of my studies, and it was very scary because we didn't know if nursing school was going to continue. And long story short, I'm not saying we didn't have teachers that taught us. We did. But when you're going to school online, you guys know it, majority of the teaching, well, in college in general, majority of the time you have to teach yourself. And nursing is a very complex thing to teach yourself. I don't care what anybody says, like it's glamorized on social media everywhere, and that's fine. Like even I glamorize a little bit. You guys will see in my community tab, I have like very nice pictures. I did a whole photo shoot and stuff like that. So it's fine. But I would say don't drink the Kool-Aid all the way. Don't drink the Kool-Aid all the way when it comes to nursing, because the schooling is very tough. Like, I'm not gonna lie, the schooling is very tough, but it's doable. I always like to put that. Like, nursing school is like this, and I guess a lot of things that you want in life is like this, and I'm reteaching myself this. In nursing school, the old you must die in order for the new you to emerge and for you to be successful, because nursing school will really push you and see if you're in it for the right reasons. And in nursing in general, like right now I'm an RM, like there are challenges, okay? I'm always constantly, right now, I'm trying to find my footing as an RN. It's been a challenge, like transitioning from an LPN to RN. I made a video on that before if you want to see it. But right now, I'm feeling better. I'm feeling a lot better, and I'm understanding who I am and how I want to work and stuff like that. So that's a really good thing about nursing, guys, is that nursing provides you with the opportunity to work when you want to. Yes. In fact, I think I'm going to make a video about that. I think that's going to be my next video. But yeah, I'm definitely going to do the Sunday. I'm going to definitely do the Sunday. Next Sunday, I'm going to do another live where I do the questions. But yeah, one thing I like about nursing is that nursing does provide you with the opportunity to work when you want to. Yes, there are loopholes to it, but in general, you can, which is when you work PRN. And if that's something you want to do, you can do it, Of course, you have to figure out the rest of the logistics, like health insurance and stuff like that. But that's why I like nursing. And also, there are many different branches in nursing that you can do. So yeah, I think, you know what, guys? I think after this video, I'm going to go on live and talk about my recent nursing job, which is like administering COVID back. Oh, I don't want to say the key word. Administering, the thing. But yeah, it was a great experience. I loved it. All I had to do was stick a shot in and put it in there, put in the serum, and that was it. And I liked it. Yeah, so, but I think I will make that video another time because I don't want to flag this video because this video is very helpful. But yeah, guys, I'm so happy you guys have stayed tuned to this live, and I hope it helps you guys. And if you're watching this after this live, if you have any other suggestions on how I can make it better for you guys, let me know. And I can't wait to show you guys my course and help you guys. So wow, it's been 2 hours and 18 minutes. So if you guys have any questions, you could leave it now or forever hold your peace. I'm looking at myself at the phone. Guys, I know I need to do my hair. I'm going to do my hair Wednesday. Doing my hair Wednesday. All right, guys. So like I said, I hope you guys have a beautiful, wonderful Mother's Day. Love your mothers. Mothers are amazing. I love my mom. Mom, if you're watching, I love you. Sometimes she watches and I'm like, why are you watching? But anyways, I love my mom, and I hope you guys are enjoying your Mother's Day. If you are a mom, you are awesome. You are awesome. And I hope you guys have a wonderful Mother's Day. Enjoy. If you guys have any topics you want me to do next on my next Sunday live, let me know because I didn't make the slides for it yet. If there's any burning topics you want to talk about, like any educational topics or any topics in nursing too, because I make topics in nursing too. So let me know. I know you guys like that too. So I can't leave the topics behind, right? The juicy topics. But yeah, guys, thank you guys so much for watching, and I'll see you guys later. Bye.